Hello friends, this is Dr. Nankishore. In recent times, allopathy is taking a flag from rest of the practices of medicine. In fact, allopathy was and is always treated as an all-time favorite vaping boy by most of the brands of alternative medicine. I think that's not right, and hence this video in the defense of allopathy. This is just an effort to make a case for allopathy. The term allopathy was coined by the founder of homeopathy, Samuel Hahnemann, in 1810. Samuel Hahnemann himself, ironically, was an allopath to start. The traditional medicine in those days was called as heroic medicine, which in fact was a precursor to allopathy. Allopathy was used as a derogatory term by homeopaths in those days. So the journey started with the heroic medicine, continued as allopathic medicine, now referred to as either Western medicine or biomedicine or evidence-based medicine or modern medicine. The word allopathy was derived from the Greek prefix allos, means other or different or opposite, and the suffix pathos means suffering. It is all other alternative streams denounced, criticized, censored, lambasted, and always castigated allopathy medicine. 200 years later, allopathy moved by leaps and bounds and continued its relentless journey as if there exists no one to compare, and no one really did. In fact, no one was in a position to compare, and they were left so far behind as if they existed no more. Last 30 years were phenomenal. Look at every stream of medicine. They have done an excellent job at it. Look at radiology. When I was graduating, we just had plain X-ray at our disposal. Today, we have a whole lot of imaging techniques that go with it. We have ultrasound, CT scans, fluoroscopy, magnetic resonance imaging, functional MRIs, PET scans, nuclear scans. Endoscopy and robotic surgery have changed the total outlook of surgery. Timely cardiac interventions are saving millions of lives. Newer medicines have changed the overall outlook for diabetics and hypertensives. The list is almost endless. In 1990, allopathy introduced evidence-based medicine, also called as EBM. EBM is a conscientious, precise, and judicious use of the prevailing best evidence in making decisions about the care of individual patients. It's not a medical recipe, but its proper application brings cost-effective and better health care. Its real purpose is that by the use of best possible evidence, physician chooses for his patients the best available solution to provide to him the optimum health care in every aspect. It is also used to avoid major errors during the course of treatment, and by this raises the quality of health care to the patient. EVM requires new knowledge from the doctor, which provides access to medical databases, the ability to search medical literature, and basic skills in the interpretation of epidemiological and statistical results. It's a movement which aims to increase the use of high-quality clinical research in clinical decision-making, integrating not only clinical expertise, but evidence and the best available research information and patient values. Clinical expertise means proficiency and judgment that individual clinicians acquire through clinical experience and clinical practice. The evidence-based medicine pyramid is simply a diagram that was created to help us understand how to weigh different levels of evidence in order to make health-related decisions. It helps us put the results of each study design into perspective based on the relative strength and weaknesses of each design. The pyramid consists of information and expert opinion, case control studies or case series reports. Cochrane reviews are regarded as being scientifically rigorous and increasingly used by a variety of stakeholders. Cohort study is a form of longitudinal study that samples a cohort, that's a group of people who share a defining characteristic such as birth or graduation, performing a cross-section at intervals of time. The randomized controlled trials, also called as RCTs, the systematic reviews, and meta-analysis. And then there is precision medicine. It's a medical model that proposes the customization of healthcare with medical decisions, treatments, practices, or products being tailored to a subgroup of patients instead of one drug fits all model. In precision medicine, diagnostic testing is often employed for selecting appropriate and optimal therapies based on the context of patient's genetic content or other molecular or cellular analysis. Tools employed in precision medicine can include molecular diagnostics, imaging, and analytics. Few years from now, DNA sequencing will be an order of the day. What are the benefits of precision medicine? To predict susceptibility to the disease, improve disease detection, preempt disease progression, customize disease prevention strategies, prescribe more effective drugs, avoid prescribing drugs with predictable side effects. And then there is a stem cell therapy. It is the use of stem cells to treat or prevent a disease or condition. As of now, the only established therapy using stem cells is hemopoietic stem cell transplantation. This usually takes the form of a bone marrow transplantation, but the cells can also be derived from umbilical cord blood. The theory is still in the nascent stage, but then everything has to go through that stage, and the future is bright. In a nutshell, allopathy is transparent and is always striving to change the medicinal interface to improve the lives of patients. It's quite possible that some of us find themselves at the receiving end of the spectrum sometimes, but then for better future of mankind, we will have to face a bit of inevitable. Medicine is full of lots of unknown unknowns, and exploring all these unknowns is a Herculean task. There is always a scope for improvement, and believe me, allopathy is doing its best. This video is not to demean rest or the pathies. When our forefathers invented them, it must have been for a reason. In fact, what we all require to do is to build on that foundation and grow limitless. And to achieve that, everyone needs to work on his or her respective field. Thanks for watching.